Throughout the COVID-19 crisis, not just in Australia but around the world, our nurses and our doctors, our health workers have been our frontline heroes. They are our genuine frontline heroes. We would not be where we are in Australia without the work of our nurses, our doctors. I particularly want to acknowledge our public health officials and contact tracing units around the country, and all of those that have put themselves in harm's way against an unseen but nevertheless dangerous and potentially deadly invader. And against that background, today we are honouring and supporting our nurses and doctors. I'm privileged to announce 40 million new masks will be made available to our hospitals, our aged care workers, our GPs and our nurses, our Indigenous health workers, our respiratory clinics, and our pharmacists and our allied health workers across the country. Very significantly, we will also be making available, as of today, a new mental health support through the Black Dog Institute, part of a $3 million mental health support program for frontline health workers. The stresses they have been under are real and absolute. Obviously, there's the stress and risk of their own health, but above all else, the care and concern for their patients. In particular, I want to put all of this in context of our containment and our capacity strategies. With regards to our containment, our border measures remain in place. In relation to our testing, the second limb of what we do with containment, we have now passed 700,000 tests in Australia. We are world ranked both for the breadth of our testing but also the accuracy of our testing by the London School of Hygiene and Tropical Medicine. In addition to that, our tracing continues, and our public health officials around the country in all of the states and territories have helped reduce the number of cases that we would otherwise have had by quick and rapid action. Every state, every territory doing outstanding work in the most difficult of circumstances. The app has now moved to more than 5.2 million downloads and registrations. The tech sector have told me that it is the fastest app to over 5 million in Australian history, which is a real tribute to all of those Australians that have participated. We would encourage more people to continue doing it, but you are doing a magnificent job, Australia. And then in terms of our isolation, tomorrow the National Cabinet will consider the first stages on the road out. And that's only possible because of the extraordinary work of Australians. And again, I say thank you. You have helped put us in this position where Australians will now be at the forefront of beginning to regain their lives as the world looks on. And that's an extraordinary step. So whilst we may take steps cautiously, gradually, to reduce and decrease the isolation, we will have to maintain our distancing and hygiene. It's extremely important that we keep those basic measures, the 1.5 metres, the hand hygiene, the cough etiquette. These are not polite things to do. These are life-saving, necessary measures. All of that brings me to where we are now. The latest advice I have from the National Incident Centre is 6,891 cases, 18 cases in the 24 hours, which include the update of figures from Victoria. Obviously, Victoria has announced 14 cases, 4 other cases in that 24-hour period in the rest of the country. From the outset, we said there would be spikes or outbreaks in particular areas and in particular places. And I want to thank and acknowledge the difficult work that Victoria and their public health units are doing in dealing with the particular outbreak that they're facing. And they are doing everything they can. And that's the same as other states have done as they've had outbreaks. So we need to be prepared for this. We warned about it previously, but I'll continue to say, as we go forwards, there will be cases of outbreaks or spikes, and that's why our testing, our tracing and our public health responses and our immediate rapid response capability are so critical and are being put in place. Today in particular, I'm delighted that for the first time we have passed more than 6,000 cases of people that have cleared the virus. The latest advice I have is 6,023 Australians have cleared the virus and have officially recovered. That's an immensely important statistic. Sadly, we have lost 97 beautiful lives along the way, many of them elderly. So that's why we'll continue to fight. We are down to 24 people in ICU and 17 people on ventilators, but we'll continue to push to save and protect every life. That's why today we are honouring our nurses, honouring our doctors, honouring our health workers, but in particular boosting their health support, their mental health support and their training. In terms of the health support, 40 million masks from the National Medical Stockpile will be made available now on top of the over 34 million masks to date, which have been made available. That will include 35 million masks between now and the end of May for our hospitals. It will include 1.5 million additional masks for our aged care workers and 3.5 million for our primary healthcare workers, including 2 million for general practices with a specific focus obviously on the doctors and the nurses. That will also include 220,000 for respiratory clinics, 660,000 for pharmacy, 500,000 for allied health workers and 120,000 for Indigenous health workers. But as well as supporting the health of our health workers, we have to support the mental health. We've seen around the world the stresses that coronavirus brings, and it's real and it's significant. And so as of today, the Black Dog Institute's online e-health mental health hub is available to health workers at blackdoginstitute.org.au. That complements what we're doing with the Beyond Blue coronavirus online work, as well as Lifeline, Headspace, which does amazing work, and I've spoken with Pat McGorry in only the last 48 hours, and they are doing work, Lifeline and John Brogden and so many others. But today is about the mental health of our health workers and supporting them through the Black Dog Institute's specific online 24-hour available e-health hub, and this will really provide the additional support.